Thanks everybody for joining us. I'm Lucy Beadnell with the ARC of Northern Virginia, and we are so pleased to be partnering with the ARC of Loudoun and Social Security today to be offering you this basics workshop on supplemental security income, SSI, and Social Security Disability Benefits, SSDI. So I'm going to turn things over to our presenter without further ado, David from Social Security, who's an absolute expert in all these matters. Again, we're so grateful for having him here, and we're glad you all could join us. David, please take it away.
Well, thank you, Lucy, and welcome everyone. I want to thank the ARC of Northern Virginia and the ARC of Loudoun for this opportunity for us to be together today and to share information about Social Security and supplemental security income benefits. As we get started, I want to touch base on the COVID-19 topic and how it has affected our services over the past few months now. On March 17th, we closed our office doors for in-person traffic and dispersed our employees to their homes. And so today, our Social Security field office employees are at work, serving you, but doing so from their home. One of the questions that I've received innumerable times over the past few months is, how do I contact Social Security? How do I conduct business with Social Security? We're going to talk about that specifically as it relates to the disability programs, but as a general comment, as we begin the seminar, I want people to know that we are available. You can reach us by telephone. Our local field offices are staffed from 9 a.m. to 4 p.m. Monday through Friday. And at our website, socialsecurity.gov, we have a variety of resources and information about COVID-19. You can sign up to receive updates as things change, as things occur. You'll be notified. We also have a field office locator tool, so anyone across the country can type in their zip code and pull up their local office address and phone number. We encourage you to contact Social Security by dialing those local field office numbers. We do have a national 1-800 number, 1-800-772-1213. We pull back a bit on the hours of operation. Historically, that office or that phone number was staffed from 7 a.m. to 7 p.m. Monday through Friday. Currently, we have staff available to answer the phone at the national 800 number from 8 a.m. to 5:30 p.m. So reach out to your local office and then also go online. There's a number of services that are available to you at our website, whether you're filing for benefits initially or if you're a Social Security or SSI beneficiary. And we'll talk a little bit about that as we go through the presentation this afternoon. But I think one of the key messages that I want to share with you today is that we are open. Even though the offices are closed for in-person interviews, we are open, we are working to serve you, and do not wait until you might be able to meet with us face-to-face to take care of your Social Security business. Do that now, do that today. So again, I want to thank the ARCs of Northern Virginia and Loudoun for us being together to talk about Social Security disability and supplemental security income. We're going to entertain some questions as we go through this afternoon. I'm going to focus my comments primarily on the initial application process, eligibility factors, and I hope that each of you that view the webinar learn something new, something that's practical, something that's helpful, and something that's actionable that you can incorporate into your planning for yourself or a family member who has a disability, and to be informed, educated consumers of Social Security services. So let's begin, and I want to just start by saying that the Social Security Administration has the responsibility of administering two completely different programs. Social Security, which began in 1935 as a retirement program only, with the disability insurance leg of Social Security being added in 1956, and then the Supplemental Security Income Program, which began in January of 1974. Social Security, as most of you know, is a program of social insurance designed to replace in part lost wages when one of three life-changing events occur: retirement, death, or the onset of a severe impairment. And supplemental security income is designed primarily as an income assistance program, helping individuals who are disabled or blind or elderly who meet limited income and resource guidelines. So we're going to talk about these specifically, and I'm going to talk to begin with about the SSDI, or Social Security Disability Insurance Program. Now, as I just mentioned, Social Security is designed to replace in part wages that have been lost due to the onset of a disability. And so for an adult who's filing a Social Security disability application, that individual, that applicant, has to meet our definition of disability. You know, there's all sorts of disability programs around the country, agencies that assist individuals who have an impairment, and those definitions of disability will vary from program to program, agency to agency. So the Social Security definition of disability for an adult focuses on the ability or inability to work, to perform what we call substantial gainful employment. And our definition has two components. One deals with the severity of the impairment. The second deals with the duration of the impairment. So as you can see, our definition is that an individual cannot work due to a severe medical condition. So there's your severity leg of the definition. And that severe condition has lasted or is expected to last for at least 1 year or result in death. So there's your duration. Social Security does not pay temporary disabilities. We do not pay partial disabilities. Now, that person's medical condition must prevent him or her from working or doing what we call substantial gainful employment. And I'm not going to use a lot of Social Security terms today, but that is one term that is so significant and so integral to the definition of disability that I think that all of us need to know, what is substantial gainful employment? Well, substantial gainful employment is work for remuneration. In other words, I'm receiving wages. I am earning self-employment income if I'm a self-employed individual. I am being paid for the work that I perform. And the amount of work that you can perform that then reaches this substantial gainful employment criteria, this limit, this plateau, if you will, in 2020 is $1,260 a month. So this is work that someone has done in the past. It may be work that the individual has the residual functional capacity to perform now. In other words, not only based upon the medical condition, the medical impairment, but also considering that individual's age, education, and work experience, does that person have the ability to adjust to other work? So that is our definition of disability under the Social Security Disability Insurance Program for adults. Now, when someone files an application for SSDI benefits, we are going to look at their work history to see, are there wages for us to replace? In other words, has this individual worked long enough and perhaps recently enough to be insured for that benefit? If someone came to us and said, I have a medical condition that results in a disability that prevents me from working and engaging in that substantial gainful employment, but the individual had never worked, then there would be no Social Security benefits payable because there's no earnings history upon which to file. So for someone who's filing for disability benefits, they must meet two different earnings tests. A recent work test, in other words, are there recent earnings that have been lost due to the onset of that impairment? And then a duration work test. And we're looking at how long that individual has worked over their lifetime. And those rules we're going to discuss here specifically in just a minute. You'll note on this slide that it says that certain blind workers have to meet only their duration of work test. So throughout the disability programs, you're going to find circumstances where different rules apply to individuals who are blind. Different substantial gainful activity limits. For example, For a disabled individual this year, it's $1,260. For a blind individual, it's $2,110. So you'll note this exception for blind workers throughout the program. Now, how much work do you need to be insured for that disability benefit? Well, it depends upon the age that you are when you become disabled. And the basic takeaway is the older you are, the more work that you need, the more work that you've had the opportunity to perform perhaps, and the more credits that you'll need. As you work and you pay Social Security taxes, you earn what are called credits. You can earn 4 credits per calendar year. This year, you earn a credit for each $1,410 of gross wages earned, subject to Social Security. Again, earning a maximum of 4 credits. So if someone becomes disabled before they turn age 24, then they need work in 1.5 of the 3 years preceding the onset of the impairment. If you can work and earn 4 credits per calendar year, over those 3 years, potentially you could have earned 12 credits for each of those 3 calendar years. You need 6 credits or 1.5 years of work. For individuals that become disabled after they turn age 24, but before reaching age 31, they need to have earned half of the possible credits that they could have earned from age 21 up until the point that they became disabled. So for example, if you had an individual who became disabled at age 28, that individual has had 7 years elapsed since turning age 21. They could have earned a potential 28 credits, 4 per calendar year times 7 years, 28 credits. They need half of that amount, or 14 credits. And then for people that become disabled at age 31 or later, they have to have worked 5 out of the previous 10 years before the onset of the disability, earned 20 of those possible 40 credits before their disability began. So we will look at that, and I don't want anyone not to submit an application for Social Security disability insurance thinking, I have not worked long enough. That could be true. And if so, we'll tell you that, and your application would be denied based upon the lack of insured status. But do not self-deny. Contact Social Security, submit your application for disability benefits. Let us look at your earnings history and determine whether you meet these work tests. Do not assume that you do or you don't. Let us do that as part of an application. Now, supplemental security income, on the other hand, has nothing to do with what you've done in the past. It's an assistance program, a cash assistance program, and we pay these benefits, as I mentioned earlier, to disabled adults and children. We pay this benefit to people who are blind, and we pay this benefit to adults age 65 or older, as long as these individuals meet financial limits. We're talking about non-medical factors of entitlement, income, resources, living arrangements. And we're going to talk about that when we get to the point of the webinar where we're discussing SSI more specifically. But SSI is based upon current circumstances, current need. SSI payments are financed from income tax revenues, not Social Security taxes. So the program is a separate, distinct program from the Social Security programs. Some individuals will file an application for SSDI only because their current income or resources perhaps makes them ineligible for SSI. Other individuals will file an SSI application only because they do not have a work history upon which they can file. And some people will file for both. And that's very common that when someone files for Social Security benefits, they reach out to us and they tell us, I am disabled, I'd like to file for benefits. We will explore your eligibility for both of these programs and take the applications that are appropriate to obtain from you at that point of application. This slide shows you some comparisons between the 2 programs, SSDI versus SSI. As I mentioned, Social Security disability insurance, the payments come from the Social Security trust funds from the Social Security taxes that the workers are paying. SSI, on the other hand, is provided or paid from general tax revenues, not Social Security. Social Security disability insurance is an insurance that workers earn by paying Social Security taxes on your wages. SSI, on the other hand, is a needs-based public assistance program that does not require a person to have a work history to be entitled to SSI. SSDI pays individuals that are disabled and unable to work, irrespective of your income and resources. When we take an SSDI claim, we will never ask you questions about assets and living arrangements and income that you have. The only income that we're going to ask about in the SSDI application is workers' compensation and public disability benefits, but we're not going to ask about most sources of income. They're immaterial to your eligibility. SSI, on the other hand, because it's an assistance-based program, we're going to ask you detailed questions about your income and resources and living arrangements. And again, we'll talk about those factors of eligibility shortly. SSDI pays benefits for workers who, and we also have disability benefits under two other circumstances. One of the questions that was posed dealt with one of those circumstances. We pay disabled workers, we pay disabled widows and widowers beginning as early as age 50. Those benefits are being paid off of the work history of a deceased spouse. And we also pay a benefit to disabled children of parents who are retired, receiving Social Security, disabled themselves, receiving Social Security, or deceased. And I'll share with you just one example. When I was growing up, I had a friend of mine who at age 14 dove into a creek, broke his neck by hitting his head on the bottom of the creek. And at age 14, my friend Charles became a quadriplegic. Now, he did not file for Social Security at age 14. There was no earnings history upon which to file. He had never worked and paid Social Security taxes. His parents were mid-career, neither of whom were Social Security beneficiaries at that point in time. The SSI program did not exist, so this took place prior to 1974. But if it did exist when Charles had his diving accident, he would not have been eligible for SSI as a minor child because of his parents' income and resources. Years passed, and eventually he did file for SSI, and Charles actually went to work and became insured and ultimately received SSDI benefits. So that's just one example, and I think a key message today is this. For parents who have children with disabilities, Social Security very well may be part of that child's future when you, mom or dad, decide now is the time for me to retire and begin receiving Social Security, or in the event of the onset of a disability or your death, those benefits also exist. SSI, on the other hand, pays benefits for children and adults in financial need. And again, you see the reference about limited income and limited resources. So just a little overview of the programs, the intent of the programs, who is eligible, who is accessing these benefit programs. Now let's talk about SSDI specifically, and then we're going to spend more of our time today focused on SSI. But I do want to talk about the SSI-DI program. Now, when should you apply for disability benefits? And the common rule is as soon as you become disabled. There's a lot of misinformation out there about I have to wait 5 months to file, I have to wait a year to file. You hear these things and maybe you do not act timely, but we want individuals who become disabled to submit an application as soon as they can. An application for disability benefits here in Northern Virginia will take on average 3 to 5 months to process. We'll talk a little bit about the application process and the steps that claim goes through after we receive it in just a moment. But because it does take a while to process an application, don't delay. File your application as soon as you become disabled. We may ask you to help us obtain information. One of the questions that I receive is, do I have to submit my medical records when I file a disability claim? No, you do not. You will be asked detailed questions about your medical service providers, and we'll use that information to contact those providers and obtain your medical records. But sometimes you can facilitate the application by submitting information to us. If you have information, submit it. We'll include it in your file. But do not delay filing an application under the false assumption that you must submit this information at the point of application. File as soon as you can. And how do you do that? Well, you can file a Social Security disability application online. You see the online application is available to you at our website, socialsecurity.gov/disability. You can do so 7 days a week, almost 24 hours a day. A lot of our claims do come to us through the internet, and I would encourage you to consider that as your filing method. There are basically 3 items of information that are completed when you file a disability claim. The claim itself, which is going to ask you questions about you, your name, your date of birth, your place of birth, your Social Security number, some general questions about your impairment, the nature of the impairment, how it affects your ability to work, some dates about when the impairment began. Those sorts of questions are on the claim form itself. We're also going to ask you to provide your permission for us to obtain those medical records. And third, we're going to ask you to complete an adult disability report. And this is a detailed form that's going to solicit information about you, the nature of your impairment, some dates about onset, dates about work activity, stop work dates, those sorts of things. We're going to ask you questions about your medical providers, as I mentioned. We're going to ask questions about activities of daily living. We're going to ask about perhaps sources of other medical records through the Department of Rehabilitative Services or through the schools. Maybe we're talking about an individual that has an individual education plan or an IEP. We would want to receive that as part of the medical documentation. So we're going to solicit all of that information from you on that disability report. All of that can be done online for individuals that are filing an SSDI application. Or you can call us. You see our national phone number listed there, 1-800-772-1213, and schedule an appointment at our local offices. Now, currently with COVID-19 in place, that appointment will be a telephone appointment. Under normal circumstances, you would be offered your choice of a telephone appointment or an in-office appointment. So right now, we are not offering those in-office appointments. Your appointment would be by phone, or as I said, you could do your application with us online at socialsecurity.gov. So you submit an application to us. What's going to happen? Well, we're going to receive that application. Our claims specialists are going to review it to make sure that you meet some basic requirements of eligibility. We're going to look at alien citizenship status, for example, and some other non-medical factors of entitlement to ensure that you meet those basic requirements. We're going to check your work history and make sure that you're insured for that benefit, that you meet those work requirements that we talked about just a moment ago. And if you meet those requirements, then we're going to forward your application to the Virginia Department of Disability Determination Services. Social Security has a contract in every state with that state's Division of Vocational Rehabilitation, and those state employees are the individuals who will be making the disability decision on behalf of the Social Security Administration. Our local field office staff are not trained to make disability determinations. So we forward that off to a state disability determination office. They will contact your medical records or your medical sources and obtain your medical records. So the state disability determination service office receives that application, contacts your medical providers, obtains those medical records, and they will use the information from the doctors, the hospitals, the clinics, the institutions, the schools, those medical treatment sources that you've identified on your disability report. They'll use those medical records we obtained from those sources to make a disability decision. Now, how are they going to make that disability decision? It's basically a 5-step process. First question is, are you working at the point of application? In fact, on your Social Security disability claim, we will ask you that question. Are you working? And if so, we're going to ask you to complete a secondary form. It's an SSA 821 work activity report. You can view this online at our website when you click on our forms tab. Again, that form number is SSA 821, and it's going to elicit information about your current work activity. If we determine that you are engaged in substantial gainful employment, the Social Security field office staff, that claims specialist, will deny your application because you are engaged in what our definition of disability says you are unable to perform. So first, are you working? Just because you're working, though, does not mean that we cannot move this claim forward. If we determine that your wages are not considered substantial gainful employment, then we're going to move your claim forward to the State Disability Determination Office for that medical determination. When the DDS, or the Disability Determination Service Office, receives that application, they're going to look at this. We will have already addressed your work activity. If we've not, they return that claim back to the field office to do so. But once we've addressed any current work activity, then the question is your medical condition severe? Does it prevent you from engaging in substantial gainful employment? Not only the work that you've done in the past, but remember again, any work that you may have the residual functional capacity to perform, considering your medical impairment, your age, your education, and your work history. There is something called a listing of impairments. In the old days, we called it a blue book when it was actually a paper book. We called it the blue book because it was bound in blue covers. But you can view these listing of impairments at our website. So the DDS will determine, does your impairment meet or medically equal one of those listings? Oftentimes over my career at Social Security, people have asked me this question: David, what is the Social Security Administration looking for in terms of medical documentation to establish that my impairment is a disabling one, would qualify and meet Social Security's definition of disability? And so I've often advised individuals submitting a new application for benefits to go to our website, even if you're not filing online, which I certainly encourage you to do. But even if you're not filing online, go to our website and look at this listing of impairments. Look at your medical impairment and see the medical documentation that we're looking for. That will so much help guide you in answering questions. Fourth, can you do the work that you've done before? Maybe you're able to do so and we would not determine that you're disabled. And if not, again, do you have that residual functional capacity? Are you able to transition to other types of work? So that's the 5-step process that we and the DDS will move through as we evaluate that application to make that disability determination. Once that decision is made, we'll tell you what that decision is. If it's an allowance, then that claim will come back to the local field office for us to adjudicate, to get your payment started, if you will. You will receive a notice of award that will show the amount of your benefits, the entitlement dates, and how much your benefits will be, and what your reporting responsibilities will be. Now let me stop for just a moment and give an example of someone that files a Social Security disability claim and that application is approved. As I mentioned earlier on that disability report, we're going to ask you some dates about the date of onset of the impairment, the stop work date, those sorts of things. So if someone is found disabled for SSDI, we will establish a date of onset, a month, day, and year that your impairment became disabling, a month, day, and year that your impairment no longer allowed you to engage in substantial gainful employment. There is a 5-month waiting period from that date of onset before you become entitled to those benefits. So if someone were to become disabled today, July 30th, 2020, their 5-month waiting period would begin with August and would run through those 5 months of August, September, October, November, and December. The individual would be entitled to benefits effective January of 2021. Social Security benefits are paid after the month is ended because you have to be entitled throughout the month. You do not know if that will be true until the month has come to a conclusion. So that January 2021 payment would be received in February of 2021. If that decision made by the Disability Determination Office is a denial, in other words, you do not meet our definitions of disability, you will receive a notice of disapproved claim. That notice will explain the decision and why we made that decision. And it will also provide you with your appeal rights. You have 60 days to pursue adverse determinations by Social Security. And so if we deny your claim, we're going to explain what those appeal rights are and the steps that you can take to file that appeal. You can do that online, and those URLs are included in those denial notices. Now, if you are filing for Social Security or receiving Social Security, there are 3 things that we want you to notify us about. There's more than 3 things, but there's 3 specific things that I want to mention in this webinar. One is if you have an outstanding warrant for your arrest, if you are convicted of a crime, or if you violate a condition of parole or probation. And the reason why I highlight these 3 items today is that there are rules in place that prevent Social Security from paying individuals who may be convicted of crimes, incarcerated because of crimes, or in violation of a condition of their parole or probation. So we need those individuals to report these events if they occur. So we have Marilyn Morrison on the line today, or viewing the webinar, and she's going to be doing a seminar, a follow-up with you guys in a couple of weeks. I want to just leave this nugget of information, this takeaway for you to think about, because I know you're going to come back for more. If our definition of Social Security disability is so focused on work activity and the ability to perform substantial employment or not, then over my years at Social Security, one of the comments that's been made to me repeatedly, logically so, is then obviously, David, if I'm receiving Social Security disability insurance payments and I return to work, then those payments must stop because I will once again be engaged in substantial employment. Well, I want everyone to know that we have special rules called work incentives that allow you to work, allow you to test your ability to work and still continue to receive those benefits. And not only can you continue to receive those benefits, you can also get help with education, rehabilitation, training that you may need to help you to return to work successfully. And so I want you to know that if you return to work, we're not going to automatically, immediately stop your benefits. There are specific rules in place that the next webinar is going to address that encourage you to work, that assist you to work, that allow you to keep your benefits, and also for individuals that have been receiving Social Security disability insurance for 24 months, they have become entitled to Medicare, and that Medicare coverage can continue. So please, please don't not attempt a return to work under the false premise that I'll lose my benefits, I'll lose my health insurance coverage as soon as I go back to work. That's not true. Nothing could be further from the truth. So let's talk now and change our focus to the SSI program. And unlike Social Security, that does not pay benefits to minor children as a disabled minor child, SSI pays disability benefits to both children and adults. We have newborn children that qualify for SSI. We have seniors that qualify for SSI. So SSI can come with you, carry you through your life with you through life's journey, if you will. So let's talk about the SSI program. And as I mentioned earlier, SSI stands for Supplemental Security Income. It's a cash assistance program paid to individuals 65 years of age or older, individuals under age 65 who are blind or who are disabled, who have limited income and few resources. We fund those programs, benefits through income tax revenues, not Social Security taxes. Now, the definition of disability for an SSI applicant who's an adult, someone age 18 or older, is the same as the definition for the Social Security disability insurance benefit. The person cannot work due to a severe medical condition that's lasted or is expected to last for at least 1 year or result in death. And again, that medical condition must prevent the individual from performing substantial gainful employment. Same definition under the SSI program for an adult as it is under the SSDI program. Now, to be eligible for SSI, in addition to being disabled, then you have to meet income resource guidelines, and we are going to consider living arrangements. So we're going to talk a little bit about these non-medical factors of entitlement. Income, what is that? Well, it's money that's coming into you new this month. It could be wages, Social Security benefits, unemployment, workers' compensation, pensions, any income that comes to you new in this month. Under the SSI program, income can also be considered to be in kind. I'm not receiving income per se, but I'm receiving assistance for food and shelter needs. And Social Security is going to put a value on that food and shelter need that's being provided to the SSI applicant and consider that as income. We'll talk more about income in just a minute. Resources are assets, things that you own, something that you had, not something that's new today, but something that you possess, something that you own. It could be real estate, bank accounts, cash, stocks, bonds, cash surrender values of life insurance policies, an automobile. And some of the resources that you own, we count, and many of the resources that you may own are excluded under the SSI program. And we'll talk about that in more detail also in just a moment. And then your living arrangements. Now, to be eligible for SSI, you must live in the United States or the Northern Mariana Islands, okay? If you're not a U.S. citizen and you're lawfully residing in the United States, you still may be eligible to get SSI. And I'm going to talk about SSI for non-citizens in just a moment. But to receive an SSI payment, you must reside in the United States. Here in Northern Virginia, we have SSI beneficiaries. Let's say we have a senior citizen SSI beneficiary who resides in the United States, but was born elsewhere. And they visit their home country. When they leave the United States, their eligibility for SSI will end if they remain outside the United States for 30 days or longer. Their SSI eligibility can start once again when they return to the United States after a 30-day waiting period. Now, as I mentioned, for non-citizens, you may be eligible for SSI, but in August of 1996, legislation was signed into law that severely limits SSI payments to non-citizens. For individuals that entered the country after August the 22nd of 1996, they may be eligible for SSI if they fall into what we call a qualified alien category. What is a qualified alien? That is an individual that meets some additional requirements, and I'll mention two of those today. One is that individual has resided in the United States, worked, paid Social Security taxes, and earned 40 or more credits of coverage under the Social Security program. They have had work for 10 years or longer, in other words. Another qualified alien category is someone who has served in the U.S. military. So those are just two examples of an individual that may meet that qualified alien category requirement. In addition, they have to meet all the other rules of SSI eligibility, including the limits on income and resources. But once again, if someone, you or someone you know who is not a U.S. citizen is interested in filing for SSI, do so. Reach out to us. Let us explore your eligibility. Now, I'm going to talk about income. I'm going to talk about resources. I'm going to talk about living arrangements. And I know there's a whole lot of questions about income and resources and living arrangements. And I hope what we share in this webinar will answer those questions. And if not, then look to our website for additional information. We have great information there at our website. Or call us, ask your question, get an answer to that question, and make informed decisions. Social Security divides, or the SSI program divides income into two broad categories. It's either earned income or unearned income. And why the distinction, you may ask? Well, we treat these incomes differently. As a general rule, we count less of earned income than we count of unearned income. So what is earned income? Well, it's wages, remuneration for work. In other words, I get a paycheck. I am earning a wage. That is earned income. Earned income also includes net earnings from self-employment as reported on a federal Schedule SE for self-employment. Earned income also includes payment for services in sheltered workshops. Generally, for earned income, we exclude the first $65 a month that's received and count half of the excess. So if someone were to earn $100, for example, in a given month, we would exclude $65 of that. We have $35 remaining. We would count half of that, or $17.50. So an SSI beneficiary works and earns $100, their SSI payment could decrease by $17.50. Unearned income is everything other than wages. So we're talking about Social Security benefits, unemployment benefits, veterans benefits, interest income, pensions, annuities, cash. You know, sometimes we ask that question on your application, has anybody given you any cash? That is unearned income. And as a general rule, we exclude the first $20 per month of unearned income and count the remainder. So if an individual had $100 a month of, say, Social Security benefits versus $100 of wages, we would exclude $20 of that Social Security benefit and count the remaining $80. So that SSI beneficiary has a Social Security benefit of $100. The SSI payment would be decreased by $80. Whereas if that individual had $100 of wages, the SSI payment would be affected by $17.50. So I hope those two examples that I share with you today help highlight the distinction and the significance of the type of income that someone's receiving, earned income versus unearned income. Resources, as I said, are assets. They're things that people own. Some of the resources that we count are your liquid resources, money that you have immediately available to help meet your food, clothing, shelter needs, including things such as bank accounts, CDs, IRAs, stocks, bonds, 401ks, a second vehicle, or third, or fourth, as the case may be. And you'll notice on this slide that it mentions life insurance. What we're actually counting is the cash surrender value of life insurance policies where the face value of the policy or policies owned is $1,500 or more. And we also count non-home property that you own or have an ownership interest in. Now, people often will ask me, what are these limits? When it comes to income, I'm not going to give you a magic number today because the amount of income depends upon the type of income, who has the income, the household composition. So there are variables that affect what those income limits may be. Resources, on the other hand, are more finite. For a single individual, for someone who's filing an SSI application as a disabled individual without a spouse, either because you're not married or you and your spouse do not live together, the resource limit is $2,000. For an eligible couple filing for SSI, that resource limit is $3,000. Some excluded resources are your home in which you reside. And your home is defined as that dwelling and the property, all contiguous property upon which it sits. So it could be a townhome in the city, or it could be a house and several acres of land out in the county. We do not exclude a vehicle. But as you see, we do count multiple vehicles, second, third, fourth. We do not count burial plots that you own for yourself and family. And we can also exclude some resources set aside for burial. That depends upon some specific circumstances, which will vary from applicant to applicant. But as a general rule, we can exclude up to $1,500 of additional resources as a burial exclusion. So when people file an application for SSI, we'll ask you those questions about your income, about your resources, to determine, are your income and resources above or below the $2,000 or $3,000 applicable limit. If your resources are below that limit, everything's fine. We can move forward with your claim. If your resources are over that limit, you are ineligible for SSI. We will deny that application. You can reapply if you spend those resources down below your applicable resource limit. And then I want to talk a little bit about living arrangements. And I know there's a whole lot of questions about living arrangements. Generally, living arrangements may affect how much we may pay you, but they will not prevent us from paying you a benefit. The exception to that is for individuals who are living in a public institution, such as a jail. If you are living in a public institution, generally, we will not pay you SSI benefits while you are a resident of that public institution. And people ask me, why is that? Well, remember, SSI is paying money to assist with basic food, clothing, shelter needs. If you're incarcerated, for example, those needs are being met. Otherwise, you are not in need of an SSI payment to meet your food and clothing and shelter needs. So we're going to ask you some questions about your living arrangements when you file an application. Do you live in your own home? Do you have an ownership interest in that dwelling? Do you have rental liability? Are you living with others in someone else's household? Are you living in an institution? For example, a nursing facility. Some of our seniors who are receiving SSI, or some of our disabled beneficiaries who are receiving SSI, if they go into a care facility, and Medicaid perhaps is paying for most of the cost of their care, then their SSI payments are capped at $30 a month maximum. So we're going to look at those living arrangements and ask you detailed questions about those to determine how does your living arrangements impact your SSI eligibility and or payment amount. Now, if you're receiving SSI, there's certain things that you have to report to us. In fact, many more things than if you're an SSDI beneficiary, but you have to report any changes that it can affect your eligibility for SSI. So you have to report any changes in your income and your resources and your living arrangements. And you need to do so within 10 days after the end of the month in which that change occurred. If we're talking about reporting wages, we do have a number of ways for that to be done electronically, including most recently through the My Social Security Account portal. And I'm going to mention my Social Security accounts as I end my comments this afternoon. So this slide has bullet points of specific items. I'm not going to read all of those to you, but again, just realize that you need to report any changes in income, resources, and living arrangements to us. And those same rules apply about reporting if there's a warrant for your arrest, if you're convicted of a crime, or if you violate a condition of probation or parole. Now, if you'll excuse me just a minute, I'm going to take a sip of water. And let's talk about children. We're talking about individuals under the age of 18. And as I mentioned earlier, SSI pays disabled children, unlike Social Security that does not. Now, a child also may include someone under the age of 22 who is a student regularly attending school. The significance of that deals with how we treat earned income. There is a student earned income exclusion for SSI beneficiaries under age 22 who are classified as a child. But for today's webinar, let's focus on our minor child, someone under the age of 18 who is filing an application for SSI benefits. Who's going to file that application? Well, probably their caregiver, a parent or a legal guardian, but not the minor child themselves. Now, the definition of disability for a child under the SSI program is different than the definition of disability for adults under the SSDI and SSI programs. Remember, under the SSDI and SSI program, that definition focused on ability to work. A minor child will not be working. A 3-year-old will not be working. Now, granted, a 15, 16, 17-year-old child may be working, but we're focused on the fact that a minor child's definition of disability is not focused on the ability to work, but rather is guided by the fact and the definition that the child has an impairment, physical or mental, that results in marked or severe functional limitations. And again, the child can be blind or disabled. We make that distinction, okay? And if he's blind, he or she is blind, then they're going to meet that same definition of blindness as applies for adults. The disability has to meet a duration element, just like for adults. The severity element is that the impairment results in marked or severe limitations in functioning. The duration is that this condition is expected to last for 12 months or result in death. The disabled child has to live in a household that meets those income and resource guidelines. And so for a minor child, we're looking at the income and resources of the disabled child and the parents who live in that household. So for example, children can have income. They can be receiving child support. Perhaps they're receiving Social Security, or perhaps they're receiving gifts. And those are just 3 income examples. But we're going to ask questions about the income of that minor child. We're also going to ask about the income of the parents. And here's a term that I want to introduce to you. It's called deeming, D-E-E-M-I-N-G, deeming. And what is deeming? Deeming is the consideration of parental income and resources in determining eligibility for a minor child. So let me just give you 2 examples that I encounter regularly in the outreach that I do. Here in Northern Virginia, a lot of our activities over the years have been working with the ARC and other agencies that serve disabled children, such as the public school systems. We've participated in transition fairs around Northern Virginia, the Circle of Support Conference that's held in the fall of each year, and other venues. And so I have met families who are comprised of a parent or parents, children, including perhaps a disabled child. And the parents work, for example, and their earnings are too much for their minor child to receive SSI payments. Through this deeming process, we're going to consider a portion of that parental income as being made available for the support to meet the needs of that disabled minor child. And so we're going to ask mom and dad, mom, dad, about income and resources when they apply for SSI for their minor child. So if the parent has income, we're going to consider that. If the child's under age 18, lives with that parent, we can also consider parental income in certain circumstances where the child is away at school but comes home, so they're still considered a resident of that home unit. So we're going to look at parental income. Now, we're also going to consider the resources of the parent. Now, if we have a minor child who's receiving SSI, when the child turns age 18, we're going to make a new disability determination using the adult rules. In other words, we're going to evaluate the disability looking at the ability to work as that definition of disability, not the marked age functional limitations as we did for the minor child. When the child turns age 18, we're no longer going to count the income and resources of the parents, even if that child is still in school, still considered a child per our definition. Once they turn age 18, parental income, resources no longer count. And so if we have a family that's reached out to Social Security and inquired about eligibility for SSI for a minor child, and they were told, your child is not eligible because of mom, dad's parental income and or resources, age 18 attainment is a trigger moment to recontact Social Security. And in the work that we've done with ARC and the public school systems, that's a key message. If you've inquired about your eligibility for a minor child and and your child's not eligible because mom, dad make much money, then contact us at age 18. Nothing may have changed other than the child had a birthday. They didn't move out. They're still living at home. They're still going to school. But everything changes in terms of SSI eligibility because that parental income and resources are no longer considered. If that's your case, then you should submit that application in the birth month. An SSI application has a life of 2 months, the month that we receive the claim and the following month. And so we're going to consider parental income through the birth month, through the month that your child turns age 18, but we would not consider that income, those resources, the following month. So if your child was 18 in July of 2020, for example, and you filed in July of 2020, we would say perhaps that parental income, parental resources does not allow payment for July, but we can look at eligibility starting in August. If you do it any earlier than that, then parental income and resources covers both months, and that application would be denied. Now, let's talk about SSI for adults. Someone age 18 or older is filing for Social Security or filing for SSI. They may be able to file online. There's some limitations to that, but they can certainly complete that disability report online. And you can do that for minor children also. If you are filing for SSI online and you're between the ages of 18 and 65, you've never been married, you're a U.S. citizen, you haven't applied previously, and you're concurrently filing for SSDI, then you can file your SSI application online. Otherwise, what you need to do is call us. Call your local phone number, look it up on our website, or call the national 800 number that you see on the screen now, or use the TTY number if that is applicable. I want to point out that our office hours during COVID-19 have changed. I mentioned that previously, but I want to highlight that again. The 800 number office hours are 8 a.m. to 5:30 p.m. Monday through Friday currently. Call, schedule an appointment with your local office. And again, that will be a telephone appointment currently, and we'll do the application with you over the phone. When we get an SSI application, whether it's a minor child or an adult, what happens next? The same steps as what happens with an SSDI claim. We're going to forward that application to the State Disability Determination Service. They will reach out to the medical providers that you identified on the application, on that disability report, either for a child or for an adult, and they'll begin that process. You may be asked for additional information about daily activities. And I want to emphasize that when we ask questions about daily activities, be specific in your responses. You know, years ago, I took an application when I was a claims specialist from an individual, and when we asked the question about how the impairment affected that individual's ability to care for their personal needs, they responded by saying, "I cannot do anything." And that's not really an answer. You know, what specifically are you saying? You know, what is it specifically that you're unable to do? You know, so just take the time. And if you go online and you look at these disability reports, you're going to find that we have some guides, some help desk, if you will, that help you in framing your responses to those questions. You know, people often ask, what are you looking for? Well, we're looking for a response. We're looking for an answer. And there's no trick questions here. We're just trying to elicit information about how your impairment affects your ability to work, how it affects your ability to care for daily activities. And again, once we've received those medical records and that evaluation has been made and a decision has been made, we're going to notify you. If it's allowed in an SSI application, you're going to hear from your local office again. We at this point may want to verify some of the income and resources that you told us about when you filed your claim. We may need proof of some of those income and resources that you told us about. But we're going to update your application. We're going to determine the amount of money that you're entitled to receive under the SSI program and begin issuing those payments to you. If that decision is that you're not disabled, again, you'll receive a notice of a denied claim along with the appeal steps that you can take within 60 days. So I hope today that we've been able to share with you a brief overview of benefits. I know some of you have questions, and I hope that we can use our remaining time to answer those questions that you may have.
Absolutely. So, David, we've got a number of good questions in. Thank you so much for folks who sent questions in to us. I wrote them down, and I'm doing my best to kind of keep them in the order in which they came in, because some folks chatted questions and some folks Q&A'd questions. Both are fine, but we'll get rolling through things as best we can. So one of the first ones we got, and David, I'm excited to share this because this is a real trouble spot that we see often, is that there's an adult with a disability who is nonverbal. The individual with a disability thus cannot give verbal consent on the phone for parents to help with the application, even though parents are power of attorney. The individual doesn't have or need a guardian, they just don't use language to speak. And the parent seems to be at a bit of a standoff with Social Security where they're saying, I need verbal consent or a guardianship order, and this person's not capable of giving verbal consent and doesn't have or need a guardian.
What do you do, right?
Yeah, what do we do?
Yeah, I'm at an impasse. What do I do? Well, there is a term called proper applicant. And we know at Social Security that some individuals cannot take the steps needed to initiate an application. They're nonverbal, they're in a coma, whatever the case may be. And so if that is the applicable situation, the message that needs to be committed or communicated to Social Security is just that this individual is not able to initiate the claim on their own, and that I am the proper applicant. as you said, maybe I've got power of attorney, which we don't recognize per se, but it's an indicator of interest. I know that that's an issue. I know that that's happened. I've encountered this real life circumstance in my career more than once. If you are not able to communicate and move the claim along by saying just what we've said today, that we have a nonverbal applicant, I am a family member, I'm a friend, whatever the case may be, I'm positioned to act on this individual's behalf, proactively initiate the application. If that becomes an issue and you're not able to communicate that and get the necessary or the appropriate response from Social Security, reach out to the local office manager. Tell them, I want to talk to a manager, because there is that proper applicant provision just for this scenario. It happens, and we know it happens. And once, now, let me just say this. You know, if I'm talking to you on the phone and you tell me that this individual is nonverbal, you know, I can't verify that. I may have some additional questions, but working together, we should be able to document the need for a proper applicant, because we're talking about benefits and potential loss of benefits. An SSI claim is effective generally the following month after we receive it, unlike Social Security, where there can be up to 12 months retroactivity. So, you know, not filing an SSI claim today versus next week in real life makes a difference in the effective entitlement month. You know, you file today, your claim could be effective in August. You wait till August to file, it's effective in September. But proper applicant. And we have information at our website about proper applicants. So you might need to remind someone you're talking to about that provision.
That's a great answer. Okay, and so we've got one person who says they're really struggling with getting replies from Social Security for an initial application, that they feel like they've been submitting information and sharing what they're supposed to, but they're not hearing back. Any tips for them?
Okay, well, now it kind of depends, I guess, on exactly what's going on. You know, generally, when someone files a claim for disability benefits and we have all that we need to forward it to the state agency, then there is that period of silence, 3 to 5 months, while the state disability determination office works on processing that application. Your local field office staff do not necessarily know the day by day, blow by blow, you know, tracking of the claim. We can look up an application. We can ensure that it's at the state disability determination office, that it's active. We may not know exactly where they are in the process day to day. So, you know, it's a little hard to answer specifically that question. If you're submitting something that we've asked for example, the claim's been approved and I've asked you to verify parental income and you've sent in pay stubs and you're not hearing anything from me, then that is a concern for you and also for us. I mean, because we want to adjudicate the application and pay the benefits. So I would hope that your field office is responding to the phone call. If not, again, you might want to reach out to an advocate like ARC, to reach out to someone like me, to see what we can do to move things along.
Thank you very much. We've had a few questions from rep payees wondering, where do they report wages if the person with the disability who is receiving benefits earns wages either on an ongoing or temporary basis? How and when do they report those?
Oh, great question. Great question. And it highlights something that's really new and something that I want to talk about today, my Social Security. What is my Social Security? That's a portal, an online portal that you create an account and you gain access to information for you. For people that are beneficiaries, they can effectuate changes to their Social Security record, like a change of address or a direct deposit change, or get a benefit verification letter. Those sorts of things you can access self-serve, if you will, through the My Social Security portal. For those of us that perhaps are not Social Security beneficiaries, it's a tool that allows us to access our Social Security statement. That mailing we used to send out annually of your earnings history and estimates of benefits. That's available through your My Social Security portal. Here in Virginia, people can get replacement Social Security cards through that portal. You do not have to come into the office. You don't have to submit ID documents. You just click the button, if you will, and the card's in the mail, literally. For representative payees, historically, you could not create a My Social Security account for that beneficiary, for that adult beneficiary. And you have to be an adult to have a My Social Security account. But a representative payee could only create a My Social Security account for themselves, not for the individual for whom they served as representative payee. That has changed somewhat, specifically about reporting wages through the My Social Security account portal. So if that is your scenario, I want you to go to our website, go to My Social Security, you go to socialsecurity.gov/My Social Security, and look at the information that we now have available about how you can report wages for someone for whom you serve as representative payee. There are some other electronic reporting methods, but I want you to look at that My Social Security portal. It's a great new tool that we've recently rolled out.
Fantastic. That's super helpful. So we got another great question about someone who's doing an initial application, and they were asking, do they need to go out on their own and get something like a neuropsychological evaluation totally done and updated and have a brand new one in hand when they file an initial application?
Right. That's a great question. The short answer is no. We're not going to require you to do that. Now, recognize that when you submit the disability claim and you fill out the disability report, we're going to ask questions about medical service providers that you've seen. And if there's no medical service providers, and that may be the case, legitimately so, but if that's the case, then what Social Security traditionally will do is set up what we call a consultative examination, where we send you to a medical provider in your community that sees you on a referral basis to evaluate, examine you for specific items that they've been asked to look at by the state disability determination service. Now, if you feel that, you know, getting updated information will enhance the application process, you can certainly do so, but Social Security is never going to require you to go to a medical service provider prior to submitting an application. What you may want to do is submit your claim, and if that's something that you're doing for other reasons also, go ahead and pursue that appointment and then notify us when that's occurred. But don't delay filing for any lack of medical records that may exist.
That's really helpful. So the next question was, what do, oh goodness, can't read my own writing. Disabled adult child beneficiaries do when they are turning 18? So how is that a different thing to
Okay. Yeah, great question. Okay. So let me say this. If we have an individual who becomes disabled, an unmarried individual who becomes disabled before reaching age 22, that's our definition of a disabled adult child, okay? Age 18 is not a significant age. Age 22 is a significant age. Age 18 is significant in the sense that the person is now an adult. So at age 18, that now disabled adult child, what should they do? Well, it depends upon the family and what's going on. If neither parent is receiving Social Security benefits or deceased, there's no access yet to that disabled adult child benefit. Like my friend Charles, that I shared the example, had a diving accident at age 14. He was 36 years of age when he filed an application as a disabled adult child. His father was 62, filing for his retirement. So there were 22 years that elapsed from his point of injury until an actual application was filed for Social Security. Because we're talking about an individual with a disability turning age 18, I would say one thing that definitely needs to take place is the exploration of eligibility for SSI. Whether the child, now young adult, lives at home or not, we've learned today that parental income and resources are no longer factors of eligibility. So that 18-year-old at that 18th birthday should explore SSI eligibility at the least. And when you reach out to Social Security, we're going to explore eligibility for other benefits. We're going to ask about, the parents and look at whether that door is yet open for that disabled adult child benefit.
All right. So the next question we got, and this came in as you were talking about non-U.S. citizens and eligibility, and the question was about whether or not DACA recipients are eligible for Social Security benefits.
Excuse me, about whether who?
DACA recipients.
Oh, DACA. It's all based upon date of entry. That legislation passed August 22nd, 1996, was called the Welfare Reform Act. And basically what it did is it closed the door to SSI eligibility for non-US citizens, except for those individuals that meet one of those qualified alien categories. DACA is not a qualified alien category. So if someone came into the country post August 22nd, 1996, they're not a US citizen and they do not meet one of those qualified alien categories, they are not eligible for SSI.
Thank you very much for clarifying that. And we got another great question, which we get often at the ARC, about prepaid burials and saving money for burials, and now that can affect Social Security eligibility.
Okay. Burial funds and exclusions can get a little complicated. If someone has a prepaid burial contract, the real question is that money accessible? In other words, can you cancel the contract? And so what's all important is the wording of that prepaid burial contract. Is it revocable or irrevocable? If it's revocable, it would be a countable resource for SSI purposes. If it's irrevocable, it's an excluded resource, okay? So that's how we look at prepaid burial contracts. Now, as I mentioned, there's also a burial fund exclusion of up to $1,500. That $1,500 maximum exclusion amount is reduced by any other funds that are established for burial. So for example, if someone came in, and I'm just making up some dollar numbers as an example today, if someone came in and they said, I have a $5,000 prepaid irrevocable burial contract, that contract itself is an excluded resource, but it would diminish the burial fund exclusion to zero. So you could not set aside $1,500 on top of the $5,000 irrevocable burial contract. If there's no funds set aside for burial at all, no provisions, then that individual could set aside up to $1,500 as an excluded resource. They wouldn't have to buy a prepaid burial contract. For example, they could just open a bank account that says burial fund account for Susie Smith or Tom Jones, and we would exclude that. up to $1,500.
That's very helpful. So the next question we got from someone who's trying to navigate Social Security and special needs trust together. And they were just told that an inheritance someone is receiving, even though it's deposited directly into the special needs trust, is still counting against them because the deposit into the special needs trust isn't court ordered.
Okay. So I know there's a lot of questions about trust, and instead of trying to answer a specific scenario with a yes, no type response, what I want to say about trust is this. Why are we talking about trust? We're talking about trust to answer the question, is it a countable resource or an excluded resource? It's all about resources. So some trust can be counted, some trust can be excluded. It depends upon the wording of the trust. There was some conversations earlier about ABLE accounts. ABLE accounts are excluded up to $100,000. So, you know, there's excluded trust. We have here in the Philadelphia region, which we're part of the Philadelphia 5-state region, we have a trust cadre that has been responsible for reviewing those trusts. So when someone comes in, files an SSI claim, there's a trust involved, that information is sent to the trust cadre for them to review. We also have attorneys involved to review this. So it can get to be very, very complicated. Admittedly so. And I really hate to answer questions about, yes, under that scenario, it's countable or it's excluded. We have information at our website about trust. We also have what we call SSI spotlights. And one of the topics in the spotlights are trust. So here's my answer. Work with us. If you disagree with the determination that we make, you will receive a written notice of that determination. For example, if you file a claim and it's denied on the basis of excess resources, and those excess resources are a trust, and you disagree with that determination, file an appeal. Pursue that, and let us look at that.
Thank you. Yeah, persistence is key, right? Especially when you're dealing with a large bureaucracy that's looking at
Exactly.
thousands and thousands of people and documents and all those kinds of things. Okay,
Exactly.
Really helpful. So this is actually a question that I've gotten a few times recently, and someone chatted in today too, that they're having trouble getting their rental agreement acknowledged and approved. So the person with a disability applied at age 18. They had a rental agreement in at the time of the application showing they would be paying rent to live in their parents' home once Social Security benefits were approved. And the person was approved for benefits, but at that reduced amount. Something about that rental agreement seems to be hosing things up.
Right. Okay, great question. I was waiting for that one. I knew somebody was going to ask me that question today. Now, so we're talking about two things. We're talking about living arrangements, and we're talking about income. Now, remember early on, we talked a little bit about living arrangements, whether you were living in your own home, whether you had rental liability, whether you had ownership interest, whether you were living with others. And so what we're talking about, and I'm just going to use a case, and I'm going to get kind of a case example, and I want to kind of carry this through. So we have a minor child receiving SSI, living with a parent or parents, and all things considered, the child is eligible for SSI. They turn age 18. Social Security is going to do a couple of things at age 18. Number one is that child is no longer a disabled child. That person is a disabled individual, a disabled adult, if you will. We're going to do a medical review to determine, does this now adult meet our definition of disability for adults? We know they met the definition of disability for children. The question is, do they meet the definition of disability for adults? Their living arrangement as a minor child was a minor child living with a parent. And we were deeming, if you will, parental income and resources in determining eligibility for that minor child. At age 18, the child is an adult. We have stopped deeming income and resources of the parents. But their living arrangement has changed. They haven't moved. They're still living at home, if you will, but they are no longer a minor child living with parents. They happen to be an adult living with other adults who are related to them. It could be a brother or a sister, a mom, a dad. It could be friends, but it's one adult living with other adults. So the question becomes, what is your living arrangement? Now, if an SSI beneficiary lives with someone, lives with other adults, and does not contribute towards household expenses, food, shelter expenses, Social Security is going to say you are receiving in-kind support and maintenance. You're not receiving cash, you're not receiving money, but you're receiving in-kind support and maintenance. In other words, you are being provided with food and shelter. And remember, SSI is all about providing assistance to individuals to meet those needs. We're evaluating what are your needs, what is your income, what is your resources, what are your living arrangements. So if the individual says, I'm living with other adults, they happen to be mom and dad perhaps, and I'm not contributing towards household expenses, then we're going to place a value on that in-kind support and maintenance. It's going to be considered unearned income, and it's going to reduce the SSI payment. How much is that value? It's 1/3 of the full federal benefit rate for an individual. This year, that's $783 is the full benefit amount. So 1/3 of 783 is, let me do this real quick. I've got my calculator here. If y'all don't mind me looking down away from you just for a moment. 1/3 of that is $261 a month. So we subtract that from your full FBR, your full federal benefit rate, and pay you accordingly at a reduced amount. That's a topic that families bring to us all the time. Now, let's talk about other possible living arrangements. One would be that the individual is living with other adults, again, just happens to be mom and dad, and they say, I'm going to use a part of my SSI payment to contribute towards household expenses. I'm going to pay towards those food and shelter expenses in the home in which I reside. The question is, are you going to pay your pro rata share? So what's important here is how much are the expenses and how many individuals are sharing those expenses. The lower the expenses, the larger number of residents in the home, obviously the smaller your pro rata share, perhaps the easier it is for you to pay your pro rata share. If you are paying that pro rata share, then we will treat your living arrangement as one that we call living in your own household. Now that's just a term that we use at Social Security. You could live in your own household because of home ownership, because of rental liability, or because you're paying your pro rata share. So some families, that's the avenue that they pursue and they use. And if you're paying your pro rata share, you're not receiving in-kind support and maintenance. There's no income there to be countable to reduce your SSI payment. And then the scenario that you guys bring up today is, I'm renting. Now, under the SSI program, we look at the relationship between you and your landlord. And there is a policy that recognizes that there may be a rental subsidy involved if the renter is related to their landlord either as parent or child. And so the question we'll ask is, your now young adult is renting from you, how much rent do you charge? And perhaps how much would you charge to a non-relative to determine whether that's a viable rental arrangement or not? So if you're renting for $25 a month, that's not going to work, for example. So that could be the reason why someone says, I have a rental agreement, but it's not increasing that SSI payment. because we may be saying that it's not, viable. It's not, there's still subsidy. There's still assistance being provided to the SSI beneficiary. And I hope that helps.
No, that was fantastic. I wanted to thank you for answering all of the questions that you have today. And as a reminder, this will go up on our YouTube channel where we have some other benefits. This is the first in a two-part series. The second will be on August 13th, same time of day, when we'll delve into complications with waiver and work incentives and all those other kinds of places where Social Security benefits can get extra sticky. And we hope to see everybody then.